At first, I'd like to thank you for the invitation. I'm very glad to be here, to be part of this team, and it's a great opportunity to discuss about cosmetic procedure, and I'm going to show something about Brazilian experience. So, as was said before, there are many different fillers, different HA fillers in the market, and all of them promise to be the best. And the truth is we need to know their rheological properties and presuppose the clinical results they can bring us. And when Eptic arrived in Brazil, we need to know what was new in this hyaluronic acid. And we studied their rheological properties. Only to remember, we have to say that Eptic in all the presentations S100, 300, and 500, they have the same HA concentration, which is considered a high concentration, the same particle size, with a moderate to high cohesiveness, and they vary on their cross-linking degrees. But why are these properties important? It's important because not only the G prime matters, together with the HA concentration and the particle size, they define the gel firmness. The cohesiveness, it's important because it's related to the tissue integration and the vertical projection. And both the gel firmness and the cohesiveness are responsible for the lifting effect, which is the most important result we want when we are treating with cosmetic procedure. So based on the rheology properties, we defined our protocol, and we used S300 to treat the middle phase, to treat not only to volumize but to sustain the middle phase, treating the malar region, the piriform space, and also the zygoma, sometimes the infrazygomatic region. And the S500 can also be used in the middle phase, mainly to treat heavy phase or when we have an asymmetry. S300 is our first option to treat the lips because they promote a very natural result. But in older patients or in thin lips, we can also use S100. The first choice, the first option for us to treat the lower face is Eptic 500 to treat the mandibular line, to define the jawline, and also to increase the height and project the chin. S100 was indicated to treat for refinement, to treat the subcutaneous superficial layer. As we can see here, I'm treating the temporal area, and we can see the image through ultrasound. And as it's good for refinement, it treats very well the folds, wrinkles, and we think that it's very nice option for sustain the perioral area before treating the lips. I'm going to show some cases. This first case is a young girl with, she is 24, complaining about tear trough, dark circle eyes, and thin lips. And at the examination, we could see that she had an asymmetry. The right side was less structured with less volume. And this is the first, just after the procedure, the result with a natural result, natural lips, and a better proportion among the sides. And here again, her profile, the improvement in the tear trough and eyelid cheek junction with the beautiful lips. The second case is a girl, she is 28 years, and she was looking for beautification before her wedding, and it was very clear to see that she needs to treat the lower face, and here before and after, just after, given better proportion among the lips, inferior and superior lips, projection of the chin, and a better contour of the face. This woman, she is 34 years. She had a heavy face. It was, these cases are more difficult to treat. Heavy face without contour, without definition of the jawline, with short chin. And just after procedure, it was possible to give her a better contour, define the jawline, protect the chin, and improve also the middle face. Again, her profile to show that the results were sustained after 3 months, and even after 6 months we could see that result was sustained, and we can see that it seems to be even better over time. I also had the opportunity to do some ultrasound studies to evaluate hepatic tissue integration and hyaluronidase degradation. This first case is to evaluate hepatic S500 over time. So on the top we can see the dark hyperechoic oval image in the subcutaneous layer just after application, and after 4 months we see that the gel is dispersed and very well integrated into the tissue. The second one, this study, we compared the S500 to other high G prime products that use Vycross technology, and as we can see, the hepatic was well integrated into the tissue, and Volux after 11 months was visualized as a dark block gel pushing the fat around it. And the last one is to show the degradation of S300 in the lips that was degraded after a few minutes application of hyaluronidase. So answering the question, and as a take-home message, we can say that hepatic is a homogeneous gel with high HA concentration, with moderate to high cohesiveness, and it promotes natural clinical results even when we treat with very amount of product. It has a very good integration, tissue integration, and fast response to hyaluronidase. So this is what I have, and I'd like to thank you again. It's a pleasure to be part of this team. Thank you very much.